Scenario 3, constipation in a baby. Very common scenario in your daily general practice and your OSCE or clinical exam. So when you have a scenario like this one is mainly taking history from the mother. This is a history taking scenario where you spend up to 3 to 4 minutes in the history. Then when you ask the examiner for findings, he's going to give you some findings. More or less, he will say the abdomen is normal, child is well hydrated, child is normal. Usually constipation will not have any findings unless they are severely constipated, where you can actually feel hard lumps in the large bowel or abdomen, but usually that will all be normal. The key here is history taking. You have to spend 3 to 4 minutes on history taking, usually 1 minute to 2 minutes on examiner for findings, because it's not an examination scenario, and this is another 2 to 3 minutes. So here it is explaining the diagnosis to the mother. So this is a common scenario, I see it all the time. So what you do is, when you explain the diagnosis to the mother, I usually use the RCH guidelines, Royal Children's Hospital guidelines, and you explain to the mother about, depending on the age of the baby here, the guideline will change. So if you go to RCH guideline and type constipation RCH guideline, you will know everything. So it is very easy scenario. Again, as I said, the key here is history. You need to again use my ABCDE approach, OSCE Triple A approach, then the traffic light method. These are very, very important. And again, the doctor who actually is my student who took the exam smashed all the cases. The reason, because he has this step-by-step approach. There is no way he will miss anything. Trust me, no doctor knows all these ones because I have created them. If you believe like Dr. ABC is doing this or Dr. XYZ is teaching, that's a nonsense. Or maybe he was my student before, he saw my videos and he is teaching the same concept to other people. So if you would like to know, how to approach in a systematic way, how to be successful, how to be a good clinician, and how to smash the exam like my student who took this exam yesterday, and if you want to be successful like me, like pass all 16 cases in first attempt, then you need to join the group coaching program. So let me just go into the ABCDE approach, where you look for action words, you look for blunders, you look for common diagnosis, then you use direction, then E, then you use the traffic light approach, which is like an ancient Greek memory technique I teach here. Then so where you don't miss anything. In a child you use the Binde network, mnemonic, and once you do that, once you implement the ABCDE and the traffic light and Binde, your history is all done. Then when you ask the examiner, because you already took great history, examiner is going to give you everything, then you know that it's a case of diagnosis of constipation. So you explain that to the mother in simple terminology, no jargon again. That's where you lose marks, when you use too much jargon. And I advise you to follow the RCH guidelines for constipation, because that is the best one. It's a free one, you don't have to do anything. And I will see you in the next scenario.